World Vision US, an international non-governmental organization, has urged Langkaku, a community in Kwampang local council area of Plateau, to embrace the Zero-dose Immunization Program ZIP in order to curb its infant morbidity and mortality. The organization made this known in an interview with the news agency of Nigeria NAN when the team of Race for Sahel Project R4S project members visited Langkaku, a community with great difficulty of access and apparent lack of social amenities. Dr. Enrique Paz, R4S Chief of Party, World Vision, who noted that the visit is to assess the needs of the community, urged members of the community to embrace the intervention, saying it is at no cost to them and would secure the health and future of their children.
What we call, technically, we call a micro-planning. That means planning what our needs, where are those children, who are the community leaders, where are the mothers, how we can communicate with the mothers and the fathers. And that the fathers, please engage your children with your families, bring them to the health center, and if not, look and help us identify who are those children. They need water, they need nutrition. I know that there's a lack of jobs, there's poverty in the community, but if we can organize, we can mitigate those problems, at least having our children healthy. At least they're free. Vaccines are free, so that will at least put us in a good place to have them healthy. We talked with the governor of Plateau yesterday, and he said to us,
and I'm sure saving their lives and strengthening their bodies would be instrumental to what they will become in the future.
Similarly, Dr. Mercy Ahun, Acting Technical Director, Race for Sahel, said in spite of the obvious challenges of the community, the group plans to surmount the barriers to the community's inability to access adequate health care for their children.
We are here because this program covers reaching children with immunization, those who have never had immunization or under-immunized, with immunization services which will protect them against killer diseases like malaria and pneumonia. And our particular focus is about children in conflict and fragile settings below 5 years of age. So Langkaku is one of the communities that we are working with. It's taking us a while to come here, and looking at this kind of road, it shows how people who live in such faraway areas have difficulties in accessing immunization services. So our plan is to engage with the community, find out the barriers that prevents them from accessing immunization. Because just from the talk with them, they all agree that measles is a disease they want their children to be protected against. And then we look at how we can work with them to find solutions and then offer services which are convenient for them and which can protect them and save the lives of their children.
For his part, Dr. Mognan Nshi, the technical lead, Race for Sahel Nigeria, said the aim is to reach where government may not be able to with healthcare services for the unreached children.
We acknowledge that government has a challenge of in terms of coverage, and we want to complement them by expanding reach to areas that they may not have been, reaching adequately, so that there will be a complementarity in terms of vaccine reach. This trip to Langkaku is to bring our partners, to bring Gavi, to bring our coordinating hub, which is World Vision, to see what it looks like coming to such communities.
Also, Mr. Martin Olauj, Director, System Strengthening, African Christian Health Association's platform, noted that though the magnitude of challenges in the community are visible, he is certain the community members are positive and would be receptive to the intervention.
The magnitude of the challenge that we are facing, but the short time I've been in the community, I see a community that is positive, a community that needs just to be supported a bit, and we shall be able to achieve the objectives of this program.
Some highlights of the visit included stakeholders' engagement with community members, cultural displays, and tour of the only existing primary healthcare facility.